Hey, friends, welcome back. We're here with another episode of ASAP Pathway Podcast. And I am, again, just really proud and excited to have a colleague and friend with me today, Dr. Reza Moshiri. Welcome.
Thank you so much. Thanks for having me, Stacy.
Um, Gosh, before I introduce you, I mean, we're in town together. Can I just say I'm proud of St. Louis a little bit? I mean,
No doubt. Yeah, no, we definitely are. I think we have a lot of great practitioners here, and we're progressive and trying to, keep things moving forward.
I
So,
agree, I agree, I think we get the flyover state comment a lot, but I think a lot's happening in St. Louis, and we're gonna dive into what those things are, but I'm just very proud of, what's happening in our city and the future. But for those of you
absolutely.
who do not know Dr. Moshiri, I mean, he's kind of the bomb. Um, he's been a faculty he's been a faculty member for Align Technology since 2013. He's the co-founder of the Aligner Intensive Fellowship, an online residency that has educated nearly 5,000 orthodontists worldwide on the proper treatment planning and use of clear aligners. Currently, he's a clinical assistant professor in the orthodontic residency program at the Center for Advanced Dental Education at St. Louis University with a focus on clear aligners. He serves on the clinical advisory boards of Orthodontic Partners and Lightforce Orthodontics. He serves as an associate editor for the Voice of an Expert column for the AJODO Clinical Companion. He is also a diplomate of the American Board of Orthodontics, as well as a fellow of the American College of Dentists, the International College of Dentists, and the Pierre Fauchard Academy. Welcome, oh
Thank you so
brilliant
much.
one.
Thank you. I'm so honored to be here.
So, I mean, we were talking a minute ago just about things happening in St. Louis, and you and I have known each other for a long time, and we've had many lunches together and conversations over the years on our journey, where we're at, where we see the future. Um, and last year, you had reached out to me and said, "Hey, I'm gonna, Reza Movahed and I are putting together an event called Winds of Change. This is his first year, and we'd love to have you speak." And I'm like, "What are you guys doing?" And of course, um, it was fantastic. I mean, it was packed. The speakers were phenomenal. The first thing I said when I got on stage was just how proud I was of or am of you and Reza for what you're doing and pushing our profession forwards. And here we are again. We've got another one coming in 2025, January 17th and 18th. For those that haven't registered yet, do it. I'm going to have the link in the podcast at the end here. But just over the years, I've been on this airway sleep apnea mission in my life. What It's called the Winds of Change. What is happening in your practice, in your life, that you're like, something has to change, and I want to be part of that front pushing the change? What are you seeing?
Yeah, it's an interesting kind of journey, I guess, because as you know, I work a lot with Reza, who we're very blessed to have in town, and he is really specialized in doing a lot of orthognathic surgery. But in doing that, he obviously treats dental facial deformities, but a big part of his, I think, mission has also been to treat sleep apnea via orthognathic surgery. And so I've been working with him on a lot of these cases, and he ends up referring me quite a bit of patients where I'm working up these cases. I'm doing a lot of the decompensation necessary to set up for the actual orthognathic surgery itself. And in kind of looking at all these patients, you just see a trend of, neuromaxillaris class two or bimax retrusive over and over and over again. It's like, and just reflecting on it, you think, well, why did the patient get to this point? Right? Is it nature? Is it nurture? Is it the interplay between the two things? And these are all, I think, questions that we may or may not know the answer to, but are worth diving into 100% and knowing more about. And so that's really the reason for this, is that I'm trying to then look at my little ones in the practice and just have that in my mind is, how can we prevent the progression to this point where this adult patient has been ignored or even potentially misdiagnosed in some cases, where now they're in this situation where they have to have orthognathic surgery to fix their underlying skeletal malocclusion that wasn't addressed properly or diagnosed properly at some point in their life. And so I've learned a lot from you. I've learned a lot from my colleagues, because it's one of those things that I think we still are unraveling a lot or learning more as we go through. And the whole purpose of this education, and to raise, I think, structured debate in a collegial format, right, where we can have honest discussions, use literature, bring in actual MDs into the picture as well. And so we have as many DMDs as we do MDs at the Women's Change Conference. We're just trying to understand how can we help people better and improve their quality of life. And so that's I think to this point, I've been practicing almost 20 years. I've tried to learn how to become really good with, braces and Invisalign, but I'm trying to now at this point forward, just focus on my diagnosis and really understand how can I help people better and see things through a different set of eyes, hopefully, and really just dive into that arena. So selfishly, I put this event on with Reza so I can learn more from people coming in, to be honest with you, having people that I otherwise wouldn't routinely have access to. It's been a huge really benefit for us to have this educational format in St. Louis.
It's so funny. You've said so much. I'm sitting here shaking my head for those of you not watching. I mean, everything he's saying, um, whether it's, I think a lot of us get into this too when we look at our own children, right? Or the children in our practice, and you're seeing, when I started in adult dental sleep medicine over 20 years ago, and then you're seeing the patterns, you're seeing the trends. So you and I have a very similar journey, because you're looking at the train wreck, and you're going, could we have prevented this?
Hmm.
And you're seeing patterns, and it's, a lot of us are very cautious. We're taught to be, evidence-based medicine, right? We want to help our patients, but we also want to, we don't want to be out there doing, crazy, quackery or whatever that we might be accused of by colleagues. Or and it's anecdotally, we're seeing patterns, we're seeing trends, and the literature just isn't there yet. So I think a lot of people are watching from the sidelines as to what's
Yeah,
going on. In And you have passion on both sides of
completely.
this topic, right? And it's what you just said, providing a platform to have this um, structured, respectful conversation on either side, which you said is why you formed Winds of Change selfishly to learn, which is why I was part of ASAP, to talk with people like you and have a platform so I can learn too, because this is I think when you talk about airway mindedness, TMJ health, and you start talking about children and orthodontics, it can get very heated on both sides.
Absolutely.
Um, and so I think, the debate is, why intercept so early? We can do all of this at like 12 and 13 in one phase. We don't have appliance fatigue, and um, you're not really accomplishing anything different in the dental outcome if you wait versus if we intercept early. So why do all this expansion, and why, and if there's not a crossbite, and, like you said, this is the debate. We have a lot of literature that exists on that very topic, why intercept,
Yeah.
jump in early when we can wait. But I think, again, something you said a minute ago, I think if we have different diagnoses, right? You're kind of talking apples and oranges. So the literature just isn't there to support, early interception when it comes to, airway health in children. But we do know that a lot of the compensation we're seeing dentally, and we're unraveling it to help someone with their airway, to make more room for a tongue when they're older, to bring a face more forward when they're older orthognatically. Why wouldn't we do that as a child to help their airway?
Yeah.
Um, so if you've got a retrognathic child, yes, we might want to bring their jaw forward. Maybe they're in a nighttime herps. Maybe they're in something to help airway patency. And we know there's not a growth spurt right now, but we're treating two different things potentially. And just setting them up right now in their life and removing an obstacle right now and just walking with that child and removing the obstacles as they're growing. And I do think there are extremes on both sides. You know,
Yes.
every child needs to be expanded. Okay, no, we're not saying that, you
Right.
know. Um, but unless we're having these conversations, Maz, um, I think the temperature's just really, it's really hot right now.
I mean, so we have a lot of kids in our practice that are in observation that I saw them at the age of 6 or 7, and we've indicated zero treatment on them because I just don't see a need for it. Like a class one deep bite, I'm not going to touch that. Until the child, if I'm not seeing any wear, until the child is of pubertal age, and all their permanent teeth are in. So we're not saying that not every child needs phase one, but if I see that the lower arch is compensated, that they have maxillary arch length deficiency, that the canines look like they're getting crowded out, that on their health history, the child's sitting there breathing through their mouth the whole time, for example, you got to put all the pieces together and try to help that child to thrive through those very formative years. And, if you speak to ENTs, because I was super paranoid about this for my son, for example, and he, around the time of COVID, he was 6 years old, and I was aggressively trying to get him into the ENT to get his tonsils and adenoids out because he was just mouth breathing, snoring at night, narrow maxilla, all those things. And COVID hit, and I put him on the back burner, and it just like drove me crazy because I wanted to get him help. And as soon as his tonsils and adenoids came out, and as soon as we started expanding him, he was just breathing through his nose patently.
Mm,
Imagine if I didn't have that acumen to help him because the pediatrician never said a word to me,
nope.
right?
No.
That he would have been mouth breathing and forming that way. His muscles would have been pulling on his bones, his developing face, his whole life until then one day he would have maybe came into an orthodontic opposite 12 or 13, and all that damage would have been done, right? You, no one can convince me, even if it's on the literature, that him breathing through his mouth for 6 more years would not have had a negative effect on his developing face, where all the sutures are open, the muscles are pulling on these bones, and then the muscle fiber types are forming, right? They have memory. So if you speak to an ENT, which I was saying, and you don't get the tonsils and adenoids out before the age of 5 or 6, it's very hard to reverse the pattern of mouth breathing in a kid.
Yes. Yes. It's
Right?
literally like nasal disuse, and they literally forget how to use their nose. I've had ENTs say, sometimes we'll take out tonsils and adenoids and we still can't get them to breathe through their nose. And this is
Mhm.
where myofunctional therapy is going to have to come in.
Right.
Um,
It's hard
but
for a 5 or 6 year old to really do effectively. The
yes,
myofunctional, I mean, it's just challenging. They're a kid. They're just a little kid. It's tough.
yes,
I mean, to really do those exercises properly. So we do it. We recommend it, but in reality, it's very challenging for a kid to do those exercises. So it's
it
just
is.
tough. You
And
do the
it's
best
tough. It's tough for, and if we talk about busy families, squeezing in those basically physical therapy for the face,
you can.
you're putting a extra burden kind of on them time wise. I mean, I've had that pushback from parents in my practice.
Yeah.
Now you're, oh gosh, I don't have time. They have soccer practice. They have it. Um, it's a real, I know that sounds so superficial and like, but it's your child, but it's a real thing. People are busy. And when
Yeah.
you keep adding, so if we can just get to this kiddo early and give them the best trajectory of health, I think COVID was a very interesting time for healthcare to evaluate a lot of things. When you remove something from healthcare, it gives you an opportunity to go, wait, what's happening? Which is where Audrey Yoon, was able to kind of begin the expansion process on parents that normally would have had tonsils and adenoids removed, but because of COVID, they didn't have the opportunity to get the tonsils and adenoids out. So, you know what? We're going to go ahead and expand and see what happens. And they saw some significant changes, in the tissues. So there's something there.
Yeah.
Why? We still are trying to figure things out. And it's not an either or really is what we're seeing. It's like you need both. It's
Yes.
we're not saying, don't get your tonsils and adenoids out. That's a piece of the puzzle. But there's more. And when you look at the literature, anywhere from 30 to 70%, depending on the literature, it's not curative, in children. So, um,
The contention
really,
for me too, to some extent, is like, because I have this debate with people I respect dearly, that have much more experience than me in terms of their tenure in orthodontics. And I'll say, there's studies from Linda Aronson that, taking out tonsils and adenoids was really helping children to close down anterior open bites and to help them to breathe through their nose. But there's then, on the other side of it, also studies that say that untreated children over time also then have that same effect happen. Maybe not to the same degree, but because of atrophy,
yes,
right?
yes,
And so that's where then you get this like dichotomy of opinion, right? But what's more assertive? Meaning I'm not gonna roll the dice and just see what happens. That's not where I'm gonna play ball, right? I wanna be assertive and make decisions that I want to make sure that I'm gonna do what's in the best interest of the kid, but have a better success rate than just assuming, right? Because I think some people lie on the side of conservatism because there's data or literature that says if you do watchful waiting, things will actually all of a sudden cure themselves. But that doesn't happen to everybody, and then the
no,
damage is done, right? So I don't want to roll the dice and see which side is that kid going to actually end up falling on, right? I want to say I'm going to lead you into this path because I know that this is going to be the result. And so that's where my focus is. And people would say that's aggressive, but I would say, well, that's how I'm going to treat my kid. You
yes,
know, I'm going to teach you how I'm going to treat my child. And if you don't like what I'm saying, there's another doctor down the street that may do something differently. It's totally fine. I'm not going to say they're doing anything wrong, right? This is just what I believe. This is how we're going to handle it because
yes,
I see the long term of it routinely with Reza and when we're fixing all these faces, right? And so like we're using, I know Dr. Eisenbeiss, ENT in St. Louis, but he's interesting ENT because he treats kids and adults, and not many ENTs do that.
mm-mm.
And so most ENTs either specialize in kids or they just do adults. And I remember having conversations with him. He's like, this may not be indicated in the insurance check mark list, but I see the long-term effects of what this kid's, presentation looks like in an adult patient. I am recommending tonsils and adenoids out on this kid. And that was so refreshing for me to hear that because oftentimes I make referrals to ENTs where I felt like there was a problem and they would say, well, the child didn't get this many strep throats and have this many ear infections. I'm not recommending TNA removal. And that's not a diagnosis driven decision. That's an insurance driven decision
Yes,
in my, right.
yes,
And so that's where it's just like you have to find the right multidisciplinary team. You can decide which literature you want to read and listen to because either way, there's different ones that support
yes,
your argument, and there's a lot more to be had. But I think what excites me is the next 20 years. I feel like we're gonna find that earlier treatment. In my belief, I could be wrong, is going to be the newest opportunity to help people because historically we've been letting things just kind of happen and wait, and then we treat these malocclusions when everything's been established and developed versus actually guiding things in the right position at an earlier age and maybe doing very little phase two, right?
right,
Doing less of it
100%.
on the back end, so flipping it around.
Mhm.
And so we'll
And that
see.
is something, and Mariana Evans and I have talked about this years ago when I met Mariana, golly, probably over a decade. Um, just discussing how orthodontics really needs to be flip-flopped. Right now, it's the phase one, the interceptive, not so much of a focus. It's more about the straightening the white things part, the white, the teeth, right? But really, the life-changing, the heavy lifting is the interceptive orthodontics, and it really should have more of a focus there. But it's a paradigm shift, it's a mindset shift,
Mhm.
it's an educational, it's gonna have to be a shift on the educational level too when we're pushing out dentists and orthodontists. But back to what you're saying about the study with watchful waiting, and yes, you do see some changes of the closing down, not maybe as significantly, but you see it. And even when we were at the AADSM a couple of years ago, and there was an orthodontist talking about watchful waiting and orthodontics, and but again, if you're asking different questions, you're going to come out with different answers, right? And different treatment plans. So are you really growing out? Okay, you're growing out because during that pubescent growth spurt, we see atrophy of the lymphoid tissues. but or are you growing in to neurocognitive deficits? So you're watching a child struggling to freaking breathe.
Mhm.
I don't see anything okay with that. That's just
Right.
like if it's my kid, ain't happening. And when you walk into my practice, I have to go by not only, obviously literature, my education, but I have to go by my own ethics and my own drive as a doctor. And if I have seen things in children, I am not going to treat when you walk in and you bring your child into our offices, they're now our children too, to some extent. They become everybody's child. So
Yeah.
we're going to treat the way that we feel we would treat our own children. And if that doesn't work for you, that's okay. We're
Right.
just not the practice, and that's okay.
Yes.
Um, and there are orthodontists or general dentists that may not want to do this interceptive early. Okay. But
Right.
what we're asking is you don't have to, because I know a lot of people with behavior management get a little nervous when you start talking about 5, 6, 7, but that's the sweet spot. And if you don't want to, at least open your mind to observing, asking different questions than you're asking in your health histories,
Yeah.
and then maybe refer to someone that would help that child. But we do know that, I mean, mouth breathing is not healthy. The mouth there's no aspect of the mouth that's designed for breathing. The nose has over 40 different mechanisms for breathing, not the mouth. Zero.
Yeah.
So if you see a child medically compromised, then we got to start asking some questions. And I do agree with you. In 20 years, I believe we will be practicing very differently. I mean, shoot, I don't practice the way I did 2 years ago.
Right.
And
Yeah.
maybe you don't either. So but I think what we're going to start seeing is, we're going to go back further and further in time with health, with airway, with sleep, and start asking, when did the hiccups start in growth and development? And I think gut biome is going to be huge. Diet is going to be huge, because we have to ask the questions, like you said, is this nature, nurture, a little bit of both? Epigenetics, little Johnny kind of looks like his dad. So there's some genetic, I mean, like we do see, okay, dad's retrognathic, Johnny's retrognathic, or are they both responding similarly with their genetics to the environment in which they're exposed? So
Yeah.
how much of it is environment and genetics or both?
Right.
I think we have a lot to learn. Um, but I think what you are asking, what I'm asking, is that people just be open that we don't have all the answers and we are seeing trends and patterns. And those of us helping people with sleep and airway issues in adulthood see a pattern of, Rebecca Bacow, Michael Gunson. I had them on recently, and healthy faces tend to just be healthier people,
Absolutely. Yeah.
right? So you can kind of look at a face and you see patterns. Let's start diving into these patterns and say, okay, when I see this kind of face, they tend to have these kind of health problems. How do we go back and correct? We're not saying, you know, um, extraction ortho causes this. We're not saying all these things cause it, but the reason they didn't have enough room for the teeth was, let's ask those questions. What
Yeah.
happened in the past that they don't have room for all the teeth they're supposed to have? And maybe we can go in and intercept and correct those issues. So let's dive in a little bit about winds of change. Like, let's talk about some of these speakers you have. So, like,
Mhm.
go into what you're most excited about this year.
So, to be honest with you, we tried to switch it up a little bit this year, and we actually extended it to several days. So it used to be just one day. Now it's about a day and a half. And so, I'm excited to have an orthodontist on there. Mike DeLuke is coming. Other than myself, just having a different voice and opinion on there, I think is important for people to hear locally as well. The main goal again being education for our colleagues to know when to intercept or when to refer patients at the right age, versus again seeing, which I see every week, kids come in at 13, 14, and it's like, holy cow, this is like I'm putting in TAD supported expanders and trying to undo things that should have been done at a much younger age, and just trying to avoid jaw surgery on these kiddos. But there's already still been a lot of compromise to that point, so we just do the best you can. So educating on that format, but also listening to a lot of these MDs coming in, because there's a lot I don't know about in terms of the field or arena of medicine. Obviously, being solely focused on orthodontics, that I feel like that's something I need to expand on. So hearing more physicians speak, we have a pediatric cardiologist, sleep physician, ear, nose, throat doctors, oral surgeons coming in, which are obviously dentists as well. But having just a multitude of multidisciplinary people there to really just help to educate and see all these different lenses, I guess, and how they're viewing their patients, because it is so multifactorial and very quite variable. We have a gentleman. I'll give you an example. Reza and I are treating this guy. He's a farmer, sweetest guy, and this guy is miserable, and like just in pain constantly. And we were trying to address his pain and headaches with splint therapy and physical therapy, and he wasn't getting anywhere. And he was telling us, he's like, Doc, I'm telling you, like, I think I have sleep apnea. This is not a solely a TMJ issue. I'm just exhausted. I have chronic pain and headaches. Like, I really feel like this is a overall physical thing that has not been diagnosed properly. And he went through all these sleep studies. He went through every single type of thing we could try to understand to get him diagnosed properly. And he finally went to Jerry Simmons, who was
Yep.
speaking. And Jerry Simmons does a specific test that not many, I guess, doctors do in the country, where he has the patients to swallow a sensor to then actually measure their apnea hypopnea index. And he's going to be speaking on it in Winds of Change. But this guy, having failed all these sleep studies, was diagnosed using this technique, 46 events per hour.
Severe.
And so that was the first time he was able to get a diagnosis, and so and he's just thankful, because now it helps things to kind of go fall in order for him to have his surgery done. And so he's slated to have a surgery here within a month. But just like those type of things where I don't know enough about, like, I did not understand this test, for example, until we had used Dr. Simmons, who's going to be speaking at this event. So just expanding my horizons, that's what really excites me the most, is just trying to gain as much knowledge as possible. And so we have just a nice array of speakers here. Tracy's coming as well, as she's your
Yes.
dear friend. So just just hearing the opinions of specialists who are experts in the field and trying to make myself better is what excites me the most.
I think too, like earlier when you mentioned, Mike DeLuke's coming in, another orthodontist. Let's have another perspective on things. I love that. I love this discussion. And I know what Mike DeLuke does and how he practices. He does amazing, and he was seeing patterns in his practice with, brackets, wires, on really little kids. And he's like, wait a minute, these parents are coming back telling me my kid's sleeping better, they're feeling better, they're doing better in school. And I know, and then we're seeing amazing things with clear aligners, right? Audrey Yoon's been doing ClinChecks on 2, 3, 4 year olds. I'm like, I've got a ClinCheck of hers on a 2 year old. I'm like, you got to be kidding me. This
Yeah,
stuff
she's
was,
really pushing the boundaries.
she
Yeah,
is. I know. I'm like, woman. But
yeah,
again, this is where evidence based medicine is not just literature. Um, yes, that's in there, but it's also, patterns within our practices. And the demand for the literature doesn't happen unless we as doctors, use our minds and education and start to talk to each other, have conversations, um, you know, very respectful conversations. It might be different. Someone might use brackets and wires. Someone might use an expander. Someone might use clear aligners. We
yeah,
might all have different mechanics to accomplish something similar, and what works in your hands may not work in my hands better. So it's having these just open dialogues about, hey, what are you doing in your practice? But if we could all get on the same page with what's the diagnosis and what are we seeing, what is the outcome we're trying to accomplish, and maybe you do it differently than I do it, but it's just being open to what's working, and maybe I change something in my practice, or maybe I refer because I am seeing amazing things coming out of your office. Medicine, the fact that you're bringing in more sleep physicians, you've got ENTs, pediatric cardiologists. I mean, the literature out there on airway issues in children and heart health, huge. Um, it's not just, yes, we want to grow a beautiful, healthy face. Um, there is an airway behind that face. There's an airway above, above the palate. So we are affecting the airway whether we like it or not. So
Mhm.
we really do need to have a better understanding. And that is all changing fast. But we also need to understand the medical side and start. Dentistry and medicine used to collaborate really well together. If you go back 100 years and look at some of the literature, even back then within orthodontics and medicine, and then it just got compartmentalized. So we really need to bring it back. And even within medicine, they're going through their own changes. You
Yeah.
know, they're even were the challenge to the algorithm of AHI is happening right now. We know that, certain home sleep tests, the sensors are biased towards lighter pigment. We got to get better with home sleep testing. We got to figure out, we've got children and thin women are kind of off the radar in sleep right now. And, when you send the majority of kids for a sleep study, sometimes it doesn't come back with apnea, but they're still sick and they're
Yeah.
still not breathing well. So we've got to figure out within medicine how to pick up these kids. And something that's happening right now in medicine in sleep with children in particular is movement and restlessness in sleep and the arousals that's happening. Again, we're going back to poor diet, supplementation. Is it genetics, gut health? What is it? But we have a lot of issues with kiddos moving in their sleep and not getting good sleep. So it may not be airway, but they're not sleeping well. And as dentists, as dental healthcare professionals, if we have the right questions, we can kind of pick up on that kind of stuff and
Yeah.
refer appropriately. I'm
The
just
diet and gut health
fascinated.
thing is very interesting to me. I don't know enough about that. I'd like to probably learn more about that as well, because I 100% that has to play a role in your overall health. We know it does, but that's something that I still lack, I think, education on. So maybe next Wednesday change, I need to bring on someone to discuss that as well, to kind of
Well,
add it
I
to.
got some people I'll tell you that you could get in because it's
Great.
fascinating. It's fascinating, and just having those discussions is so important. Um, but I'm so proud of what you're doing, and I mean, you really are. I looked at who you're bringing in. I mean, you've got Stanley Liu, Mariana Evans, Jerry Simmons, you got Tracy, Mike DeLuke, of course, you and Reza. My gosh, I know Nicole Goldfarb. She's amazing.
George
And then
Mandelaris is coming, who's a
yes,
great
Mandalarius, and
chicago.
yeah, we've got Dan Clower. I mean, you just got some big
Kevin
hitters.
Goodson. Yeah,
Yes,
no, we're gonna
and I
be
I
gonna
can't
be
wait.
saturated. Yeah,
You
it's gonna
are.
be very, like, I think, extremely informative, very multifaceted, multidisciplinary. Um, and I think it's just going to be a wonderful educational event for those who are in attendance. So I really appreciate your promoting it and being a part of it historically and introducing us to some of the people that are speaking there. You're a great resource.
Oh
So
gosh.
we're very lucky to have you in St. Louis.
Oh, thank you very much
Yeah.
for that. That means a lot. I very passionate about this, and my kids are now in college. Two of them are in college. One is a junior in high school, and Maz, I'm telling you, my kids have been my greatest teacher, and I'm still learning. Things aren't perfect, because as you know, we change, and um, we might be okay for a few years, and then we might have another hiccup in life, whether it's, my kiddo goes off to college and he isn't sleeping as well because he's in a fraternity, and
Yeah.
and
Right.
now and his headaches are coming back. And but what's so interesting is, and your kiddos will probably go through the same thing. We beat the drum of health and wellness. And I mean, my kids can point out a mouth breather faster than anybody in their classes. And my son will say stuff to guys in his fraternity like, dude, you're totally breathing through your mouth. You need to go see an ENT. And I'm just like, oh, it makes me so happy. But we push as parents because we want to protect our kids and we want to give them the best outcome possible. And, even just raising my son, my oldest son, at some point you have to back away and they're leaving for college. And now he is saying, "You're right, mom. When I don't get the sleep, I get the headache. I get, so he just has to have that own self awareness for his health on his health journey. And, all the vitamin D and all the stuff we've done with him over the years, all my kids. It's an interesting time. And there's things now I wish I would have caught even earlier with my kids. And if I could go back in the time machine, I'm like, ooh, what would have happened if I would have done this or this? But as we can't beat ourselves up. We move forward. We're going to learn even more in the next few years. Thanks to people like you. Like, I'm so excited. I consider myself, you know, fairly educated on this topic. And I can't wait to be there because I know I'm going to learn tons of new stuff. I know I am. So I'm
Absolutely.
really looking forward to it. And I'm so proud of you and Reza
Thank you.
for what you're doing. And
Thank you.
I'm just honored to know you, be in town with you. And I appreciate you taking the time. I know you're busy today. And we got to give a shout out to Shuka.
Yeah.
Shuka's got stuff going on today. I love her. Got to have her on too. And of course, your dad. He's just he's amazing, and he was ahead of his time too with TMJ dysfunction. That's that. And
Yeah.
I could have a whole podcast with you on TMJ and orthodontics. And you're one of the few orthodontists I know that look at the whole complex. And
Yeah, I have dad to thank for that one. So
your dad for sure. So we got to give a shout out to your dad for that. Um, but thanks for being here. I've got 3 questions to ask
thanks.
before you go. We got 2025 coming. So I was going to ask you a few questions for the new year, but first, what is the most recent song you listened to?
Most recent song I listened to, honestly, was my nephew singing a song that he learned in his nursery school. I listened to it. It was first thing this morning. She could send me a video. It was the most adorable thing. And I'd never heard of this song before, but he's 3 years old and he memorized the whole thing. And he was singing it from beginning to end. It was like a minute. It was a minute long. I couldn't believe it. He's not one to um, be very gregarious or talk. And I was just like, my wife and I both were like mouth open
Mouth
watching this
open.
song. Yeah, like we were just like in shock that he was just, and he had the best like intonation, his voice, the way he was singing along. I was like, oh my gosh, he's carrying a tune. So that was the most recent song I had listened to. To be,
I
it
love that. It's
was kind
precious.
of
I love
an
it. I
odd
guess
answer to your question.
you're not gonna sing it for us, Maz. Okay.
I don't even remember it. Yeah, but I'm sure that's not what you're expecting as an answer. But that
No,
was
I
the most
love
recent
it.
song I
No,
heard. Yeah.
that's the beauty of this. I love this real. It's a very real thing. That is the most recent song you listen to, and I love it. I love it. That's precious. Um, what is your favorite? Because this is gonna be like January 2nd when everybody's listening to this. What's your favorite season that you're looking forward to in 2025? Like winter, spring, summer, fall. What is your favorite?
Um, I always look forward to winter.
You
Winter
do?
is my favorite. I do. Winter is my favorite season. I like, and the reason why probably is because I like to go skiing a lot. And
Oh,
so
okay.
that's when I usually go to Park City, Utah, with my family, which we're going over New Year's. And that's just my like home away from home. That's where I completely just release and disconnect, and I'm in nature, and I don't think about orthodontics as much as I love it. We're just like completely 24-hour engrossed in our practices and teaching, and it's a lot. So to be able to give that mind a break, winter is where I find I have the most reprieves to take time for myself and to slow things down and to enjoy my family. So like, Thanksgiving or even the holidays, like that's my favorite time of year is winter.
I
So
love this. I think you're the first person when I've asked this season that has said winter. I'll have to go back and listen. But what is interesting about that, it is kind of a time of hibernation, right? Like it is a time to reflect, to slow down. It forces us to kind of.
yeah.
I love it. So when you go skiing, is it like the entire family, just your immediate family? Who all's going?
So it is my immediate family, my wife and my two kids. My son is now 10, Shia. He rips on the mountain. I mean, I'm chasing him all over the place.
I
Um,
love
and my daughter is 8 years old. She's a little bougie. She won't ski in a ski school. She has to have a private lesson. So she needs to have like a personal one-on-one attention. I honestly am not proficient enough to teach her because I started taking up skiing in my late 30s and I'm 44, so it hasn't been that long I've been doing it. I was like 36 when I first went skiing, but I instantly fell in love with it. And so we've been going every year since that time. And my wife it just does it to entertain me. I think she's as she gets better, she's enjoying it more. But the first time she was in tears, screaming at me down the mountain, like I've never done this
I'm
yet.
with Michelle on that one. I'd be like,
Yeah,
"What have you done to me?" Yeah.
yeah, she was not happy. But then we figured out it was her boots and technique, and she was just straining her muscles a lot, just trying to protect herself coming down the mountain, which is exhausting. But once you start to actually learn what you're doing, it's much more enjoyable. So she's been also getting lessons and is enjoying it more and more. She sees the beauty in it, and she sees what it does to me. So she's a very supportive wife, obviously, which I really appreciate that she allows me to do that. Uh, but we just absolutely love it, and it's just the culture behind skiing I love so much because it's very physical. And then you have like your après ski where you're, having a glass of wine, or you're chilling out, you're eating, you're going to bed early, and then you rinse and repeat. So it's very restful and very active. And so it's just like daily, that's what we're doing is just we're resting and we're being very active. And that's just like the best of both worlds to
I love this. No one has convinced me ever to consider skiing. I've never done it more than what you just did. I might just go for the restful part and watch everybody else, but I'm so intrigued by it. People that ski, it is a passion. Like,
me. Yeah.
uh, and so when this is released, you're going to be skiing. So,
Yeah.
yeah, that'll be great. One last question.
Yes, please.
2025's coming. What is the one thing I almost want to use the word resolution, but it's so overused. Um, what is something that you want to either change, include for yourself, add to your life that you might feel you didn't do in 2024, but you want to do in 2025?
Mm, that's a great question. Probably I would say spend more time with my kids. Last year was very busy because we moved into a new office,
Oh,
and that
yes,
is
you
a
did.
gargantuan effort to do that. And you lose balance in life at times. So I think that was the balance that was lost, is I didn't get to do enough with my children, just given all the time and effort that went into that. And moving to the office, so probably spending more time with them, carving out more time to be part of their activities, go to soccer games, be one on one with them. That's probably my main priority for the new year.
Well, you're starting it off the right way at the ski lodge.
That's
So
right.
you're on the right path, my friend. Well, thanks for
Yes.
being here. And I look forward, people listening, if you haven't signed up for the Winds of Change, please do. And I'd love to see you all there. Thanks again, Maz.
Thank you so much, sis. Appreciate your time. Thank you.
Thanks. Bye, everybody. See you next time.